My name is Cassandra Pierre. I am a registered nurse, BSN, and I'm currently in Regis College as a grad student enrolled in the Psych Mental Health Nurse Practitioner program. Today, this presentation will be about the funding for scientific research studies on curative treatment for chronic diseases. The purpose and background of this study is this evidence-based practice project is to achieve and appraise the scientific research studies that have been done in the development of curative treatments for chronic illnesses in contrast to long-term management treatments. Chronic disease has become the norm for disease maintenance, resulting in more than half of the U.S. population that have been diagnosed with a chronic condition. Chronic illness have become an epidemic in today's world, and approximately 75% of the U.S. population are dealing with a chronic condition. In quote, in just a 5-year span from 2005 to 2010, the prevalence of chronic disease increased from 46% to 47% of the U.S. population. That's equivalent to an additional 8 million Americans. And it was predicted that by 2020, it is projected to have that it would be increased by an additional 16 million, comprising 48% of the population. Chronic conditions require individual attention to prolonged treatment, management, being knowledgeable on side effects and adverse reactions, and having to change lifestyle behaviors, visiting multiple healthcare providers, and dealing with lab tests and other medical procedures. In quote, the majority of chronic diseases hold the potential to worsen the overall health of patients by limiting their capacity to live well, limiting their functional status, productivity, and are a major contributor to healthcare costs. Data from literature analysis have demonstrated that the quality of life is greatly impacted by the factors associated with being diagnosed with a chronic disease. Gaps that have been identified that the research study aimed to address. Exploratory data indicate that there is a gap in the literature on curative medicine. More peer-reviewed literature focuses on preventative management, lifestyle modifications, identifying risk factors, and advanced study in technology and modern medication. Throughout the search for the literature review, the gap in the literature for curative measures on curative medicine was limited, which proves that more scientific studies are aimed towards prolonged treatment and therapy for chronic diseases. Important factors that will be reviewed in this evidence-based practice proposal in addressing these gaps will be analyzing common treatment plans prescribed by providers, identifying if there are non-pharmaceutical alternatives to treating chronic diseases, side effects of these long-term medications, how long-term treatments have affected individuals' daily life, and identifying if the development of medication is aimed more towards long-term usage. The proposed project methodology. The outcomes of this proposal will be calculated from the patient's feedback during the interviews. The sampling size will be 4 to 6 participants, ranging from age 18 to and older. The proposed setting for this study is at a large teaching off campus in the Norfolk County in Boston, Massachusetts. The study will be carried out in a private conference room on campus. Before enrollment, the enrolling participants in this study will have to sign an informed consent and with ethical considerations. which is by the Institutional Review Board approval. The researcher will also submit an application and proposal to the Regis College first. After approval from Regis College, the institution where the study will take place usually requires approval as well. An expedited review will be requested due to minimal risk to participants. There are no foreseen ethical issues involved in this research study. The interviews will be tape recorded, transcribed, and held in a locked file in an office. The results of the interviews will remain confidential, only being available to the researcher to protect the participants. All participants will be anonymous, enabling any tracking records of participants in this research. Lists of participants will be identified by numbers instead of true identities and protected in researcher private log file that is coded and secured apart from other data analysis. The significance to the field of nursing. Although healthcare professionals provide education on lifestyle modification to prevent or manage chronic illnesses, it's still not sufficient to influence all communities or populations. Evidence-based scientific research on curative treatment will be important in the field of nursing in the following ways. It will promote continuum health within all population. It will eliminate side effects of long-term usage of medications. It will also result in less complex health issues that are not manageable. It will create less burden on nurses and healthcare professionals in feeling that they have failed their patients. And it will also provide a beneficial route to resolving health challenges and provide alternative treatments that can be less invasive and more effective. Innovation. Since there have yet to be developed studies on curative measures, disease prevention is all that can be promoted to reducing the risk factors of chronic diseases. Disease prevention is significant in eliminating the source of all illnesses. Lifestyle modification and education is an important aspect of prevention, but it is easier said than done. Although disease prevention is the main strategy being used to educate and reduce risk factors, the following innovations are elements that need to be investigated toward the aim of all funded research studies being done in the United States. Number one, public awareness should be toward questioning why are all diseases are maintained rather than cured. Number two, there should be more literature review studies on curative measures. 3, clinical or research studies requesting funds for curative measures should be held accountable for providing false hopes and goals. Number 4, to increase literature review on curative treatment, organizations like the pharmaceutical companies should be investigated on their process of establishing new medications. This scientific research study proposal should be funded due to the continuation of increased chronic conditions that more than 80% of Americans are diagnosed with. The United States have the most expensive healthcare system among all other developed countries, and yet they have the worst healthcare outcomes and the highest mortality rate that is related to chronic illnesses and side effects from long-term usage of treatments. This proposal should be funded in order to reduce the number of chronic conditions that continues to arise and to promote health among all population. The aim of treatment for illness should be towards curative measures and not maintaining measure and not maintenance measures that impacts an individual's entire life.